Good evening. My name is Dr. Zahra Kassam. I'm a radiation oncologist and director of Plant-Based Canada. As physicians, our duty is to protect and promote health. I will begin with an admission. Like most of my physician colleagues, I was not taught in my medical training about the profound link between diet and disease. It took me years in practice to realize just how much our meat-heavy diet is driving illness in our patients. Now I talk to all my patients about food because the evidence is clear. One of the greatest drivers of poor health and one of the most powerful levers for change is right on our plates. Decades of research show that plant-based diets can help to prevent, treat, and in some cases reverse chronic disease. What we lack is not science, but action. Chronic disease is crippling our communities and our healthcare system. The World Health Organization tells us that non-communicable diseases account for 3/4 of global deaths. A significant portion of these could be prevented by lifestyle behaviors, including diet. Yet in Canada, of the estimated $372 billion spent last year in healthcare, very little was directed to prevention. The Global Burden of Disease study confirms that dietary risks are now the leading cause of chronic ill health globally, causing more deaths and disability than tobacco. The top diet-related diseases are cardiovascular disease, cancer, and diabetes, top causes of death in Canada and globally. Their work found that improving diet could prevent 1 in 5 deaths, and that among the top 5 dietary risks were not eating enough fruits, vegetables, whole grains, nuts, and seeds. In other words, the very foods that best protect health are the ones most lacking. Canadians are also falling short. Less than 23% of Canadians meet daily fruit and vegetable recommendations, while red meat and dairy consumption is about double recommended levels. But solutions are within reach. Diets centered on fruits, vegetables, whole grains, beans and legumes, nuts and seeds, while reducing animal foods, are associated with a lower risk of multiple diseases, including cancer, heart disease, diabetes, hypertension, stroke, dementia, arthritis, kidney disease, and I could go on. And eating this way adds years of healthy life. This is not controversial. It's embedded in our medical guidelines, including our cardiology, diabetes, and cancer guidelines, for prevention and for treatment. Our own Canada Food Guide recommends a plant-based plate. Half the plate is fruits and vegetables, 1/4 whole grains, and 1/4 is protein. And of that protein, the Canada Food Guide advises choose plant proteins more often and every day. The Global Eat Lancet Commission came to the same conclusion with their planetary health diet, designed to feed a global population of 10 billion by 2050 and keeping within planetary boundaries. They acknowledge we don't need to eat animals, but if we do, animal food should make up no more than 13% of our calories. Following this pattern would prevent 1 in 5 deaths globally and save 11 million lives annually. And if you should wish to be 100% plant-based and leave animals completely off your plate, as I do, we can be reassured that the major dietetic organizations tell us that an adequately planned vegan or vegetarian diet is nutritionally adequate and can offer long-term health benefits. But the impacts of our food system on our health go far beyond chronic disease. Animal agriculture is the single largest consumer of antibiotics worldwide. In Canada, 82% of antibiotics are used in farm animals. This accelerates antimicrobial resistance, which the WHO ranks as a top 10 global threat to humanity. Resistant infections already kill thousands of Canadians every year, undermining the very foundation of modern medicine. Industrial farming also heightens pandemic risk. Intensive animal confinement, global meat supply chains, and habitat destruction for animal agriculture are fertile grounds for zoonotic spillover. COVID-19 showed us the devastating toll of a pandemic on our health and communities. outbreaks of infections, including avian and swine flu, occur regularly in farming operations, including here in Canada. If these strains break into humans with their high mortality potential, the results will be catastrophic. Reducing dependence on animal agriculture is therefore a central pillar for pandemic prevention. There is also stark inequities in the animal sector. Slaughterhouse and processing jobs, dangerous, low-paid and traumatizing, are disproportionately held by marginalized workers, often recent immigrants. Their jobs carry increased risk of injury, PTSD, and depression. Large-scale animal operations are often sited in marginalized communities, exposing residents to air and land and water pollution and increased risks of disease. And we cannot ignore the planetary crisis. Animal agriculture is a major driver of greenhouse gas emissions, deforestation, diversity loss, species extinction, water and air pollution, all of which circle back to our personal health. These planetary impacts cause increasing rates of multiple diseases, such as cardiovascular disease, respiratory disease, cancer, heat-related illness, infectious disease spread, mental health harms, and destabilization of the very health systems we rely on. Our medical institutions now recognize this. The Lancet Countdown Report on Health and Climate Change for Canada, in collaboration with the Canadian Medical Association, identifies shifting towards plant-based diets as one of the top 3 priorities to mitigate climate change and protect Canadians' health. In conclusion, our animal-based food system is a central thread affecting our health, connecting chronic disease, antibiotic resistance, pandemic risk, social injustice, and ecological and climate breakdown. We must resist industry-funded manufactured doubt and distractions, from greenwashing sustainable beef claims to false fake meat scares. We have a moral imperative to act. Let us prescribe one of the most powerful medicines we have, plant-based nutrition, for healthier people, healthier communities, and a healthier planet. Thank you.